All right, here we are talking about coaching and psychedelics. I'm here with David Drapkin. David, good to have you
Hey,
on the show. Finally.
I know. I'm so happy to be here. We've been talking for months. It's always been an amazing energy between us. So I'm really happy we're sitting down. Thank you, mate.
Yeah, I say finally. We've not actually known each other that long, but it feels like
Mm.
a lot of has happened in that time. This is also somewhat of a special episode because you're not technically a coach. You're not coming from that world, but you have recently created a training for coaches and also for clinicians, and that's the frame through which we connected. And so you clearly see the need for coaching, and you created something where people can learn that skill set, and you're making very important, you're connecting very important dots between the two practices. So that's why I really wanted to talk to you, not just because I wanted to get to know you better anyway, but also because not only because you're one of the people who have created coach training in this space at the intersection to psychedelics, but also because you have a lived experience of when that kind of skill set is actually helpful to come in. So I think together we can explore what the gaps are, how we can address it, and I'd love to tap into your experience of how that need shows up for something beyond the healing work that therapists do.
There's a lot of different directions we can go in. The first one that just pops into my head, working with psychedelics, the term non-dual is used quite a bit. It's kind of trendy a little bit, but the idea, around consciousness itself, but also just taking that concept more broadly, humanity, human beings. Like there's not a human they are a clinical human being or a coaching human being of how you work with them, how you interact with them, how you engage with them. So from this non-dual approach, we could honestly just say, how do we connect with people as a human, with them as another human? And that is the hardest skill that we need to develop in life, like as a parent, as a husband. How do we connect? How do we relate? That's human. That it's not, I am a different kind of human. It's a skill, and it comes from, it comes from deep within. It can be trained. It can be grown and developed intentionally. And I think working with psychedelics, it is non-dual by nature. There are very few ways that we can limit it, categorize it, define it. So it's fluid, it's dynamic, it's kind of extraordinary. Yeah.
Yeah, extraordinary. Um, yeah, and that shows up. I'm glad you're saying it because it shows up in so much of coaching for many, many years. Since I got into coaching, really, I try to figure out, okay, so where's the boundary? Where's the gray area? Where's the blurry space between coaching and therapy? And over the years, I realized it's such integrative work when we work, like you say, with people, right? One being to another human being. Clients often don't care what you call it, whether you call it therapy or coaching or mentoring or consulting or being a friend or a teacher or a guru. I mean, there's significant differences, but in the end, does it really matter? And in many ways, it really does matter, right? But essentially, when we tune into another human being and we try to support them through whatever they're facing in life, and psychedelics might be a pathway in which they try to address whatever they're navigating currently, then it just becomes okay. So there's some typical skill sets here, some typical skill sets over there, but fundamentally, we're sitting down with another human being, and some of it is skill, some of it is art, a lot of it is just present, holding space.
I want to name something as well, Yannick, that our society has, over the last century or so, probably since Freud, God bless him, has become overly medicalized, psychologized, pathologized. And some of that has led to the primacy of psychiatrists and psychologists at defining, in a sense, reality, but also the mind and how it works, pathology and diagnoses. And I feel like something that we are doing now, we could think it's cultural, it's anthropological as well, is peeling back that layer to go, actually, without those definitions, without those categories, without those limitations or kind of narrow um, kind of medical concepts, who are we as humans? And I feel like psychedelics are pushing the boundaries of clinical treatment, of healthcare systems, of government policy as well, but also culturally, anthropologically. Like, what are we? Who are we? What does life feel like? And how do we connect? And from an emotional perspective, emotions are not the same thing as clinical. So for me as a clinician, I, emotions really didn't come into my training that much. it was
Yeah.
it was a lot more rigid and psychological, neurological, conceptual, intellectual. And the more work I've been doing in psychedelics has been less about that, more about just emotions, but also somatics in the body and the nervous system. And in my previous education work, the course that I was running, it was also open to clinicians and non-clinicians. It was an incredibly diverse cohort of students. So we actually had a lot of folks that were not licensed, not even coaches. They were veterans, served overseas military deployments, and they were working with other veterans who had experience with trauma, TBI, suicidality, and addiction. They weren't coaches, they weren't clinicians, but they were doing incredibly powerful work with other veterans. We had other students that were working with end of life care as well, not coaches, not clinicians, but they were literally working with people at the end of life. Yoga therapists, acupuncturists, tarot card readers, all of these people need and have great skills, but they also need a bit more expertise around working with psychedelics so they can do it safely, responsibly. So yeah, just human beings. Wow. Let's take off the labels. Let's just connect. That's where the fun happens. That's where the magic happens. And I think we're unlearning a lot of what we've been taught as a society. And for me, as a clinician, I'm unlearning a lot of what I was fed as a student.
Yeah, yeah, it's amazing to me every time I learn that this or that is not included in therapeutic training. I remember I met Julia Vaughan Smith, who's operating in the coaching trauma intersection. She told me, "Oh yeah, therapists don't really learn about trauma." And I remember back then I was like, "What? How could they not possibly? That's so crazy, right?" But you also throw labels and who are you in there, and I think we know a lot about you already through just how this conversation has flowed so far. But I'd love to take a step back and give you an opportunity to actually put some labels onto it if you wanted to. Right? It could also be principles and values. What we usually ask our guests is, how do you introduce yourself when you're at a dinner party? And let's assume the dinner party is full of coaches. Right. So how would you tell someone who you are or what you do?
I'd start off by saying at this dinner party, I'm a pescatarian. So I've been a vegetarian, I've been a vegan, I've been a carnivore. Right now, I'm a pescatarian. That's the first thing I'd say. I don't drink alcohol really, not much anymore, hardly ever. And my relationship with psychedelics has enabled me to become just a little bit more tuned into my body, to my emotions, to what my needs are, and the difference between my needs and wants. So I eat a bit less chocolate. Um, I drink, yeah, I don't drink alcohol anymore. I do yoga. I write poetry as often as I can. I read poetry. I'm a Jew. I love Kabbalah. That's an amazing tradition with the deepest spiritual teachings that I've ever encountered. I used to be Buddhist for 8 or 9 years. I went hardcore. Like when I do things, I go hardcore. Like I was a hardcore vegan. When I was vegan, like didn't have honey, didn't wear wool or leather. I was, really pontificating. So when I was a Buddhist, I was like, fasting and living in caves and monasteries and jungles and
Oh,
um,
you really
yeah,
immerse
hard.
yourself, huh?
Yeah, totally. Um, now I'm a bit more chilled out, and some of that's just been my process of not trying so hard to prove to others or to be anything. So I started off life in England, upper middle class. My dad owned this printing factory that my granddad started um, in a town called Birmingham. And I kind of rebelled against that, just didn't want to be particularly Jewish. So I ran away from being a Jew because it was too complicated and I had too much, in a sense, trauma around what it meant to me. My family were German before they were English. Most were murdered, but a few survived and moved to different countries. And my grandparents made it to England, and I never was able to deal with that, to be honest. So I suppressed it completely. And yeah, it's still there actually. I don't know if I told you, Yannick. I've never been to Germany. I've avoided it all my life because I just couldn't face it. For a while, I couldn't even like sit in a German car or use a German fountain pen.
Yeah, fair.
I've made progress, but I changed planes a year ago in Munich airport, and I was like, oh shit, going to Germany for 3 hours. Oh boy, with my wife and kids. And the moment I stepped off the plane, literally one step, two step, I looked around. I saw all these signs in German, like saying caution, go this way, don't go that way. I just saw being in the Holocaust, and I just started hyperventilating and crying, and kind of almost literally fainted. And my kids were with me, and my wife, they thought I was having a heart attack. And my wife said, "No, it's okay. You know, Abba, that's what my name is in Hebrew. Dad, it's just yeah, something's coming up because we're in Germany." Um, so, in a sense, just my life's been around trauma, and the dance around suppressing it, kind of expressing it, and trying to be authentic. And I've tried too hard at times to be authentic. So I've gone through different types of being David. To begin with, I was super economist, money, money, money. And then I was electrocuted when I was 21, and then became this kind of Buddhist, spiritual, vegan person. That was great for a little while. It was just, it was a necessary stage in the journey. And then, yeah, becoming a Jew and moving to Israel for the first time when I was 30. That was another stage in the journey that was really important. Um, and then, yeah, becoming a dad and a husband. I've been married 14 years now. That's where the work really happens. I thought I was being great living in these monasteries and, doing these fasts and being super spiritual and wise. And, it's
Easy.
great. But, oh, having a newborn baby, being sleep deprived, trying to deal with them when they're screaming, taking your kid to the hospital when they're having stitches. You know, it's a beautiful, beautiful challenge. There's good days and bad days. So for me, yeah, just being a dad and a husband is the greatest achievement of my life, the greatest challenge for accountability. Professionally, what do I do? Lots of things. So yeah, when I kind of had in my 30s, I realized I needed a proper career. It wasn't enough just to do bits and bobs, youth work, counseling, a bit of addiction work here and there, working with homeless people. So I'd always done community work, but I just needed to earn proper money so I could be a dad and have a house and have some possessions, because I really did live like an itinerant monk for quite a while. So I went to social work school. I had a bit of a life crisis. I was, I think, 32. Didn't know what to do. I was like, what should I be? Should I do like should I learn to be like a landscape gardener or a lumberjack, or just do kind of wilderness work? Should I be a youth worker? Should I be a social worker? Should I become a psychologist? Should I be a teacher? And it was great. It was like a dark night of the soul. I just didn't have a clue. I read my journals actually a few months ago from that period in my life, and it was probably the most profound experience of speaking to God that I've ever had in my life. Literally, I was just writing it down, just speaking and pleading with God to give me clarity to make a decision about what to do. And in the end, I went to Leicester. It was literally the only town in England that still had a space to do social work starting 2 months later. So I stayed in England for two years, became a social worker, and that was life changing. It's an identity to be a social worker. It really is. It's something I believe in fundamentally, the conceptualization of social problems, social solutions, of how to treat people, how to relate to people, more from a coaching perspective, I think, at that level, and being really invested in social determinants of health. And yeah, the wellness for all, not just for the few that can afford private healthcare. So since then, I've been working in hospitals a lot, particularly in inpatient psychiatry units. So, it was an amazing experience in Manhattan, in Harlem, Upper East Side. You've got billionaires living a couple of blocks away from homeless people and people living in rent-controlled projects. And every day we'd probably get 5 new patients coming in, suicidal, psychotic, catatonic, manic, homicidal. And I'd be like, hi, I'm David. I'm your social worker. So I learned a lot there. So that was incredible working inpatient psych. with people that have suicidality. And I've had depression and OCD since I was a kid, still do. I've also experienced suicidal ideation since a kid, and I still do. So working with suicidality it's fucking hard. It's confronting, but it's beautiful to be able to meet with people where they are and for them to be able to say, I'm having these thoughts of ending my life. So, I guess we should just say a bit of a trigger warning talking about this for folks, just to look after yourself. But yeah, so that's, I identify a lot with mad people and crazy people and homeless people because at parts of my life I've worked with them, but I've also just hung out with them and I have been them as well to some extent. Yeah, and then just professionally speaking, specialized in addiction quite a lot. And then the psychedelics piece came into my life. I've used cannabis and psychedelics since I was a kid, for fun, for suppressing emotions, for spiritual bypassing as well as for deep healing. More and more
Since you
in
were
my
since you were a
since
kid?
yeah. So I started using when I was probably 13.
Wow, it's early.
Yeah, yeah. It was a crazy time in England in the 90s, to be honest. There was the rave scene, and parenting wasn't very good in those days. So we were just left to our own devices. And yeah, I was kind of just wandering the streets with my mates most of the time, going to parties and raves. And I was having OCD and suicidal thoughts and depression at the time. And I was self-harming as a kid. And the cannabis and psychedelics helped, but they also didn't because I didn't have a way of understanding what was going on or what I was trying to do. So the self-harm in a sense was somewhat healed, but it was also perhaps somewhat accentuated by cannabis and psychedelics, just suppressing it. Particularly, yeah, just with other aspects of my life and my identity. I'm bisexual as well. And so at the time, I didn't know who to be. I thought I had to be gay or straight. Um, and that was really challenging as a kid. Really, it wasn't until my 30s. And I'm now in a monogamous heterosexual relationship and I'm a proud bisexual man. And both of those things are true. And that's one of the greatest things that I've been able to just be. But as a kid, it was really, really hard. So in a sense, the cannabis and
Yeah.
psychedelics suppressed it to some extent, but they also did the opposite and sometimes enabled me to open up into that, to feel it and embrace it. But publicly, outwardly, couldn't do that. Just couldn't do it. The time wasn't ready. Or I didn't feel ready myself. And I was already dealing
There's
with so many other things.
there's that non-dualism again that you mentioned in the beginning, right? We so often try to figure ourselves out in, is it black or is it white? Is it coaching? Is it
Yeah.
therapy? Is it gay or is it straight? And I think the world is discovering more spectrums. It's the world is a lot more fluid, but it's more comfortable if it wasn't.
Yeah. It's harder to have it fluid and pragmatic and
Mhm.
pluralistic. It's hard
It's
because,
free, but it's hard.
yeah.
It's more
Yeah.
free, but more freedom doesn't necessarily mean more well-being.
But more freedom also means more accountability as well to, to,
Hmm.
to appreciate the freedom or to be able to connect with it truly. Like, wow. So in every single moment of life, there's no, in a sense, truths or limits or concepts or definitions. There's just experience. There's kind of the momentary existence. There's the connection. There's the beingness of it. And that can blow us away. Like the idea of being British or even Jewish or a man or white. Those are true. Yes, they have reasons and purposes. Passports are real. But at the same time, yeah, our universe is, 6 billion years old and hundreds of millions of light years across. So none of these words have any meaning whatsoever. But our brain can't really make sense of it. So I think a lot of what we're trying to do is just not being stuck in my brain. And for me, my brain was my worst enemy. My head was doing horrific things to me, terrible things. And I just had to get out of my head, whichever way possible. So it could be a fake identity, could be drugs, could be self harm, whatever. It might be football and things like that. Yeah, so our brain is, and that's why we're talking about like the medicalization and psychologicalization of our sense of reality and identity. We're more than just our brains. And I think coaching can really help us as practitioners to just chill out a bit around. It's not just about the brain or brain problems we're trying to solve here.
Yeah, I can see how psychedelics connected, not just personally, but also professionally, because when it's about getting out of our brains for a bit, I mean, psychedelics are really, really good at that, to just get you out of something that used to just fix you into something like a certain idea of who you are or how things are done or how to think. And all of a sudden, you're free, for better or for worse, from all of
Yeah.
these existing grooves and structures, and you're able to think in completely free ways, which can be very terrifying or it can be very inspiring. But yeah, I can see how psychedelics like sparked your professional interest as a therapist, as a clinician, as a social worker. So when did coaching come into that? Where like I guess the essential question is how why do coaching and psychedelics make sense together for you? So maybe you can tell us about how coaching came into your awareness and how ultimately you decided to bring it into your training, um, possibly as a result of what you've seen in the world as a clinician, as a social worker.
Yeah. Yeah. There's a few different aspects to this that I'll try to connect together, Yannick. One of those definitely is feeling the limitation of working in a clinical setting. So at the pinnacle of my clinical career, I could say I was an executive clinical director of an outpatient addiction treatment center with 130 patients that I was responsible for and a team of 10 people. And at that point, it was great in some respects, but it was also incredibly limiting. Like there wasn't much freedom to work with people. Everything was manualized. There were all these protocols. There was kind of audits by insurance companies. There were policies and procedures. There's compliance standards. Everything was tracked with diagnostic assessments on the medical health record. And there was a moment sitting with this one woman. She'd been in and out of rehab and detox 3 times. Sitting down with her for a 45-minute session to try and stop her from killing herself or relapsing back onto heroin and alcohol. And we just looked at each other's faces. And I realized at that point, I can't do this anymore. I can't do this because I'm not able to connect with her in a way that's real. Like just to talk to her like a normal human being. And maybe I could
Because of
say,
all the
oh,
red tape and the regulations.
yeah, I've got a 45-minute session. I'm wearing like a jacket and a shirt in my room with this mahogany table and all this stuff. And it was a lovely office, great team, really trying to do good work there. But the system's just, it's not what people really need. And then we're doing these groups to get the insurance company to pay. We have to get our patients to go to 9 hours of groups a week, intensive outpatient treatment. They don't really want to do 9 hours of groups in this office building in New Jersey with a massive car park by a motorway in the middle of nowhere. Like they don't want to do that for 9 hours. They probably want to just go somewhere else, like sit on a in the sun or in nature or totally different setting on a couch, drink tea, do yoga, stuff like that. But we couldn't do it because of the licensing and compliance standards. So there's this irony that the more, in a sense, evidence-based we become as clinicians, the less free we are to use our intuition, to connect with people as humans, to try something new out the box, to ask someone, what do you need? Or what are you here for? Because we've got everything already spelled out. We've got a manual. We know what's going to happen in week 1. We know what's going to happen in month 2. We've got all these benchmarks and tracking tools. So it's like, it's a system. It's a conveyor belt. And I don't want to disrespect it too much, but it is very limiting in just being able to feel free, to feel liberated, and to feel like we're doing the best we can. And particularly around psychedelics, it was like, I have to be able to offer psychedelics to these people. But if I do, I'll lose my job and the clinic will get shut down. So I couldn't. So I left that job. And I guess there was one other maybe story I could share, Yannick, around. I've worked with clinicians before and it was great. One of them was a Buddhist clinician, but there was probably more coachy. And I enjoyed that with meditation. So at the beginning of every session I do as a clinician, I start with meditation. with my client, maybe 3 minutes. I guide them in, but connecting with our body, arriving into our breath, tuning into what's happening in the moment. So I do that at the beginning of every session. So it's a bit more coachy, I suppose. But I worked with a coach for the first time in my life, an IFS coach, internal family systems. And it was remarkably different to working with a clinician. And it was that experience. His name's Rob Kowalski, amazing chap. He's moved from Canada to Costa Rica. And I was like, Rob, you've moved from Canada to Costa Rica, from like the snow to this jungle. Wow. And that, in a sense, epitomized some of this, just some of that non-dual, but that pragmatic, pluralistic, psychedelic, reinforced bravery and decision making to just make the decision that you need in life. And for me, coaching has a bit more of that crazy wisdom and that freedom to just change directions. It's to say, what do you need now? Let's connect now in this moment. Whereas clinical work is more about setting up milestones and benchmarks for long-term tracking and treatment plans and discharge planning. So it's more, in a sense, theoretical, more conceptual. Coaching was, using IFS in particular, was really somatically embodied, and seeing, who am I right now? What theories, what ideas, what feelings inside of me, what parts of me are, in a sense, filtering my experience of being me and of my reality, what insecurities and doubts are showing up there. And yeah, a clinician can do that, but ultimately so can a coach. So I feel like coaches just have that freedom to move between different skill sets, different theoretical models, perhaps different frameworks, without thinking, oh no, that's a bit scary, I can't do that, it's going to waste time, and I need to make sure that everything's in the treatment plan and it's measurable. It's this SMART goal that's got this KPI attached to it for this client. So those are just a few thoughts. And I guess maybe just a final piece is how it feels working with a coach. Or for me, being a coach, I'm not a coach. I can't say I am because I haven't really done training in it. But I'm a clinician that works with more of a coaching style, particularly with my clients that use psychedelics. Because with psychedelics, power, asymmetry, it needs to be managed. In a sense, the relational attunement, the connection in the moment, the tracking of each other's nervous systems, the responding to informed consent. This is all very heavily informed by, who do I think I am? What do I think my role is? What am I supposed to do? Why am I doing this job? What does this person need? What do I want them to think about me? Am I a good clinician? Am I a good coach? Am I a good psychedelic guide? What kind of review are they going to give? So all of that's coming through me. And so whether a clinician or a coach, we got to be super tuned in to what's happening inside of us. So inner work, self-awareness, being embodied, understanding our shadow, our triggers, our biases, countertransference. So that could be a clinician, but it could also be a coach. So in a sense, I'm seeing that as being shared mutual competencies that a human working with another human consciously, ethically, needs to have those skills. So that's why I wanted the course to include both types of practitioner.
Yeah, there's a whole lot more freedom in coaching to bring in what you think is right, or to move between different modalities. Lots less red tape. Well, for better or for worse, right? Because I also see the value of the regulation and why it's there, and keep people safe who are working, right? But it also is limited. So it's funny. I've been smiling because I see so many coaches in the supervision room who are, come out of the training and now they're feeling like they're doing it wrong, or they carry a sense of guilt for working in the way that they feel called to, because the initial training or maybe the professional body told you to. That's not coaching. It's not supposed to be coaching. So I see a lot more kind of tape coming into the coaching profession for similar reasons, to keep clients safe, to advance the profession. There's such a huge umbrella term, coaching, and there's so many different practices. So when you say coaching, how would you frame that when you talk about coaching skills? What is it about coaching that you add beyond the kind of freedom to integrate that you already mentioned and the meeting people at eye level, human to human, which coaching approaches seem to have a little bit more than therapeutic approaches, but also not necessarily, right? Not every therapist is with a clipboard and the code, and you're the patient and they're the expert. That's a fraction of it. So when you say coaching, what do you mean?
I don't know what I mean, is the honest answer. Yeah, I don't have a definition. In a sense, that's freeing, but it's also, it is good to have standardized and regulated and accredited programs, benchmarks and evidence-based, training and things like that. So that's all really important, whatever practice you're doing, whether it's plumbing or definitely electrical work, but also coaching. I guess one thing that just came up for me, let me just take a breath into it, Yannick. There's something around coaching that maybe traverses the different kinds of coaches that are out there. That might be leadership coaches, executive coaches, organizational coaches, coaches that work with athletes. Um, so a quality that traverses that are the questions, being able to ask amazing questions that, for me, I think they're incredibly well directed into the essence of what that person either doesn't know, but really does know, but needs to bring it from the subconscious into the conscious. Or, in a sense, you could say there's a model called motivational interviewing. I'm not sure if you've heard of that. It's used a lot in addiction treatment.
Yes, of course.
And a lot of the beauty of that is around bringing awareness to the incongruent beliefs within us, like that this and this coexist. That's beautiful. It's complex. And it might not be well known. It might be unconscious. So we're bringing that into conscious awareness. So we could say this is moving into more like the psychoanalytical way of working, or we're moving more to the coaching way of working. For me, working with coaches or just understanding coaches, it's the power of the question that goes beyond the surface layers into the essence of what that person's next step is. So those are two things, the question and then the next step. So I think too often in clinical worlds, we don't think about just the next step. We're thinking about like the next 10 steps. So for coaches, I really
They're already
appreciate,
laying it out.
yeah, and it's a treatment plan. So for coaches, I found, wow, working with my coach, Rob, that question was amazing. I hadn't been able to summarize it that concisely before, what it is I'm trying to answer, what it is that's blocking me, or the underlying belief that I have that might not be true. So it's, in a sense, I used to be Buddhist, so there's streams of Buddhism as well, that they have the Zen koans, that is this sharp, like almost like in Tibetan Buddhism, this Vajra diamond awareness, kind of just, it penetrates straight to that space of the spark of awareness, of transformation, of enlightenment. And there's a beautiful teacher in Thailand, Ajahn Chah. I'm not sure if you know, but he worked in like in a random forest jungle monastery setting. So he had this crazy wisdom of like the forest Buddhism of Thailand, where he would do these crazy things like literally pushing people over into a pile of crap, or just to say, if you want wisdom, go over there. These things are, because we think life is going to be linear and logical. And as a clinician, okay, so this is how the structure of the session goes. And this is, I'm going to start with these questions, and then we're going to end with this, and then in the middle we're going to check in about work and family and in your body awareness. How's that thing going with your son? And let's go back to your use of pornography, for example. That's what we're working on. So we're just going through the things in a predictable way. That is so limiting. So I think coaches have a bit more of this crazy wisdom of like Ajahn Chah, or the kind of Zen or Vajra Tibetan Buddhism, to just go straight into like, what's
Yeah.
the question? What's the block? What's the vision? What do you need? What do you want? Connect with that. Stop wasting time. Like, go into it. Let's go there. I'm with you.
Oh, that's
How
so
does that
interesting,
sound?
right? Yeah, it sounds super interesting because it kind of shows me how we're so influenced by the initial lenses we that help us discover coaching or therapy, right? So if I'm thinking about existential as an existential therapist or a person-centered therapist or a gestalt therapist, it would be they would probably also find it impossible to plan this out. But I also appreciate that the majority of the therapists out there, especially those who work with the systems that are established and regulated and accepted in a whatever culture you're in, is more likely to try and create something that's predictable, because then you can actually plan with treatments and then you can embed it. Only then can you really embed it effectively into a system. I wish people within, for example, the system of the UK or Germany would have a lot more access to, person-centered existential gestalt, awareness-based being to being kind of therapy. Because, I mean, somebody comes with complex trauma and he gets like, well, they get like 10 sessions of CBT, and that's just at best shift the symptom to something else, but not address the underlying issue. So it seems to me that a lot of the things that I hear being said about therapy or coaching could definitely apply to the other camp as well. But there's just so many camps, and so many of them don't have a clear boundary. So that's why it's super interesting to listen to, because that freedom is definitely there in some forms of therapy. But I think you're right that coaching brings this. I have a lot more freedom to do what I intuit is the right thing to do right now, and the the regulations that can hold a therapist and give them credibility and safety within the way that they're working can also really be in the way. And vice versa, the freedom that brings coaching, this I can do anything right now, whatever seems right, also puts some people at risk, because you can't really know what this is and where this goes. It's not so established yet, right? So that's why there's so many different people out there who do so many different things. And it's very difficult to say, okay, so this is coaching. But we could say, well, here are some coaching elements that are found in a lot of coaching approaches and also a lot of therapy approaches. But there isn't something that makes coaching this distinct thing. This is coaching.
What do you think about the idea of a starting place being how we understand the psyche, but not just the psyche, the mind, the brain, more our experience of being human that includes a brain and a psyche, but also, I'd say, memories that includes our kind of body awareness, our energy system, our nervous system, and then more kind of on a relational level, how we frame our identity in society, with work, with family. So for me, I think that, Yannick, is just a really important starting place of understanding how our identity formation happens. And in a sense, like I've worked a lot with people with personality disorders, and I've described it. It's the hardest clients I've worked with, narcissistic and borderline personality disorder, and I've described it to people as it's like, because when people have said, "Oh, what is it? Or why do I have it? Or how do you know? How does it affect me?" So I've said, like, we all have these identities that form over time since birth, and it's almost like being a tree. And we've got these rings in the tree, and you can see it. Whoa, look at those rings that happened there when you were 16, 17 years old, David. What on earth happened there? It's like, oh yeah, that's when this happened. So we can explain our lives and our identities in that way, like rings of a tree. But I actually think of it more like we're building upwards, like scaffolding, like scaffolds around a skyscraper. From birth at the bottom, let's see how many floors we can add. So right now I'm on the 47th floor in the life of David. That's where I am at. So when I look down at my scaffolding, fucking hell, those foundations, blimey, they're still there. Those foundations I laid in my first few years, God, that's what my 47th floor is depending on. Wow, I can't believe I'm still here. That's amazing. What a miracle. people with personality disorders, like, oh, wow. Yeah. So I've got these flaws that were built between the ages of 15 and 20, that this is when I start to have these experiences, particularly looking at trauma in these years, or abuse in those years, or being ostracized within society, or feeling ostracized and disenfranchised, not feeling worth in society, within family and culture. That creates this scaffolding in a sense. Oh, a few screws fell out there, or oh, that got a bit rusty there, but the floors keep being built on top of it. That's still part of who you are. Okay, so that's validating and normalizing, and it's beautiful. Wow. And we're still alive, we're still building on top of those floors that are rusty and falling apart. But that's life. So I feel like we need to conceptualize life in a way that's normalizing and validating of mental illness, of trauma, of life being difficult and complex, and not being able to truly define it. So some of those more humanistic Gestalt ways of doing it, the Jungian way of doing it, IFS way of doing it, the relational somatic way, those are all beautiful. Positive psychology, these are all really just yes, yes, and yes. They help. They're pretty much always going to be right for pretty much all kinds of clients and for all kinds of practitioners, because they help to conceptualize the selfhood and the human experience in the gritty, real way that it actually is in relation to society, culture, and family.
Yeah, I'd love to pick up that metaphor of the foundation, and I'm imagining this skyscraper that we all are in various heights, right? But if we imagine that we do get taller and taller, and then we look at our foundations, I mean, people like you and me, we already have a bunch of, foundations. Some of them might be a bit shaky. When I think about somebody who seriously got disrupted, at a very young age, then that stable is that structure is unstable, right? If we look at it in that sense, coaches have there's one thing about coaches that seems to be a tendency that's quite strongly evolved, is that coaches help people to lean quite far over the balcony and see what is possible, right? So I think there's one of the differences, or one of the things that coaches have said sets them apart from therapy, is that who's coming to the work, and are they quite resourceful, whole, creative? Are they able to lean over the balcony, get the whole structure to shake a little bit, and not collapse, basically? So one of the questions that I think is really essential, I want to put it to you, is how, like, as much as the differentiations might be limiting, there's also something very important to them, because trained clinicians like you are able to see or sense, or you've done the work to know when that structure is unstable, and or it might be about to collapse, or it is collapsing right now in front of my eyes, and you are trained to know what to do with that. Whereas most coaches, the coaches who don't have that kind of training, they don't. So I see coaches in this field, it's particularly more profound because the risks are higher when psychedelics are in play, right? So with best intentions, I think many coaches put people at great risk of harm, and they may not even realize it because they don't have that kind of training. So this may be part of why you created what you've been creating in this in the Mirari program. But like, what does a coach need to know? Like, how can they navigate the points in the structure that makes everything potentially collapse? Like, what do coaches need to know to be able to work with psychedelics who are not trained clinicians also?
Yeah, this is a big one. Let's split it into two. The first piece, maybe we're just talking, generally speaking, coaches working with people that are perhaps destabilized, how to spot it, how to react. And then part two is psychedelics, like knowing who should not be considering using psychedelics, or who might it be more contraindicated or less sensible, more risky to use psychedelics. So on the first piece, Generally speaking, most people are going to be okay to work with in a coaching format most of the time. Generally speaking, probably most people on average will be okay to use psychedelics as well. However, because it's not 100%, there are risks and there are limits to scope of practice as a coach, as there are for me as a social worker and a clinician. We have to know them. For me, I've literally been a director of an addiction clinic. However, when it came to working with eating disorders, not great at that. Working with gambling addiction, not great at that. I can muddle my way through because it's slightly nuanced. Doing couples work, I find that hard. I've done that a few times because I was the only therapist around. Okay, but just know, what am I not good at? What don't I like doing? What do I feel less confident in? What do I need more training in? Those are all valid questions. But there is a separate question: is what am I not able to deal with appropriately? And because of that asymmetry, that disparity, I must not continue. This is not the right client to say, yes, I will do this for you. Or this is now the kind of client I realize it's escalating and beyond my abilities. So I need to be really tuned into that. So we need to have a secure sense of self. And to have insecurity is fine, but to know professionally and personally when a client is getting to that limit, doesn't matter how much they pay us, doesn't matter how big our caseload is, it doesn't matter how long we've been working with them for, could be our first session, could be our 100th session. We need to be able to always, in a sense, be in this posture, being ready to go, this is, something's changed. I'm feeling different. This person's reporting things are changing in their life, or they're just presenting in a different way that I'm noticing it. I need to acknowledge this and then explore whether or not we need to either temporarily shift coverage, in a sense, of who is their kind of right level of care. Is it me? Is it go to the ED, emergency department, for assessment? Is it police because they're not safe right now? Is it they need a family therapist? Is it they need an addiction therapist? Is they need a psychiatrist to assess for they're not sleeping for days, or they're hearing voices, or they seem to have mania and they're getting quite grandiose ideas about what they're capable of. So I guess the first thing is put our insecurities to one side, put our own sense of why I do this work to one side, always be prepared to shift posture based on the needs in the room right now. And then more tangibly, if a client is presenting destabilized, how would we know? So often we'll know because something's changed. They're coming in 5 minutes late, or maybe they didn't apologize, or they're not giving us the eye contact they're used to, or they're not dressed or kept with their hair, with their as they would normally be. Less eye contact. They seem more nervous, fidgety, biting their fingers when they wouldn't normally do that. Maybe they've been smoking again, whereas they'd stopped smoking. So that's not a crisis that someone's smoking again, but if multiple of these, in a sense, sequelae are present at the same time, it's pointing to something there. And particularly if you're identifying that that person's had some kind of bio, psycho, social, spiritual change in their life. It could be someone's died in their family. A lot of the time, you'll see people that lose a pet. That is huge. I've worked with a lot of people, their dogs died or their cats died. They go into existential crisis. They have become suicidal multiple times, clients I've worked with, because that pet, perhaps unbeknownst to them at the time, was one of their primary pillars of support. And just having them there meant that much. For a lot of people, particularly men, that pillar is their job. So when you lose your job, it's like, well, who am I?
Seriously, yeah.
Who am I? So if someone loses their job, that is a huge risk factor for men of suicidality, but also of breakdown, of sleep deprivation happening, of violence, of self-harm, of addiction. So just looking for these kinds of lifestyle changes, looking perhaps for women in particular going through menopause, perimenopause, that is a huge biopsychosocial, spiritual, emotional, hormonal change. So noticing when things are coming up in life, It's just a level of attunement. And so I guess one really strong thing is having this conversation with clients at the very beginning to say, look, this work works within a certain remit. If at any point in time I feel like we're moving beyond that remit and you could benefit from a different kind of professional or a different level of support, are you okay if I say that and we talk about that and just in your highest good, in your best interests? Is that an agreement we can make now? And that's informed consent. And I always frame what I'm doing around highest good, or for your kind of your most important needs in life. So whatever that might look like in any moment. So I think that's just one way I'd frame that first part, Yannick. Any thoughts around that?
Yeah, I think this working in partnership and helping people take responsibility for what they want this to be. I don't think coaches need to be able to know. You mentioned that all these little changes might point to something. They usually do point to something. We don't need to know what they're pointing to or if they're pointing to something. It's just a matter of noticing and then getting curious about what you're noticing. But that needs to be incorporated in the frame of what we understand this work to be. And it also needs to be able to spend some time together on a regular basis. So I think a lot of coaching is very short-lived, right? There's a couple of sessions that somebody might do with a coach. And also it's often more spaced out than therapy, as in like the cadence it's much larger. And if you only meet somebody once a month or every 6 weeks, then that's a very different engagement than if you meet somebody every week for months. Yeah, if you meet somebody once a week as part of helping somebody prepare for an experience and then integrate it, you might meet them 3, 4, 5, 6 times, but that is still within a relatively short amount of time. So these long-term changes, either we don't notice them or we don't have it's so focused on creating something that we can't pay attention to all these little things. And that's a way of working which is different. It's not necessarily that this is coaching and this is therapy, but like one way of engaging somebody is more regular. You spend a lot more time together. You have a lot more openness and freedom to tune into whatever they're bringing on the day. And the other one is more focused. And a lot of coaching has that focus as a defining factor. Not all coaching has that, right? But a lot of coaching has that. Okay, let's define quite clearly what it is you want to create. Who do you want to be? What do you want to do? What sort of shift are you looking for? What are the kind of goals? What's the kind of experience you want to have in the future? And really map that out and figure out, okay, so the destination is important, even if it's just another stepping stone in the process of becoming, right? But a lot of coaching is bringing that kind of angle, that mindset of really focusing. And I think within the psychedelic space, I'm not sure how useful that is. I think it's a very useful skill set. And even within psychedelic work, it comes about occasionally when, something becomes quite clear and we can really focus in on it. But this holding of space, being witnessed, having an observer, somebody who David Drake, we had in the coaching lab recently, he called it exquisite noticing. Right? When you are an exquisite noticer and you're able to reflect that back and communicate it and then help your client make sense of whatever sense there is in there without presupposing that there is sense to it. That's the core of good work. Beyond, is this coaching or is it therapy? And then it really, I think it depends on who's coming in, what kind of work do they want to do, how resourced are they, what do they have in their first 10 floors of life? Is there something that is quite destable or unstable? And what are we actually delivering in terms of skill sets, right? Everybody's got good questions, but coaches, they really love their powerful questions, right? There's more kind of tools or interventions in there. There's stuff in the back that you have that you could deliver to disrupt a thought pattern or really step out of the cycle of how you're experiencing yourself right now. I think a lot of this is shared. So I think individually, any of those will not define that this is therapy or this is coaching necessarily. but taken together, we see a certain uh, way, something that you have access to. So I really don't think you need to become a coach or a therapist. I think it's gathering those skill sets and those mindset, those perspectives, those ways of being, and then using what's necessary at the time, figuring out how far it is that you are willing and able to go with a client, knowing where your limits are and at what point can you actually then refer to someone, not because you're a coach and they're a therapist, but because you've reached the end of your competence and it would be much better for this client to work with someone else now.
Yeah. I like what you're saying there, Yannick. You particularly said exquisite noticing. And I don't know if that's a term that you coined, but
That's what David said. I'm not sure if he picked it up somewhere, but it's just I love it. It really stuck with me. Other
yeah. So
David Drake.
yeah, so exquisite noticing. I love that. Now that you've mentioned it, there's a term in DBT, dialectical behavioral therapy. This idea of exquisite sensitivity, I believe it is, where the person with a personality disorder, because DBT is a really effective technique for that, has exquisite sensitivity to life, to others, to sensations, to stimuli. And part two of that is radical acceptance. So that has more like normalizing, coming to terms with, embracing of our radical, our kind of exquisite sensitivity. But it is that noticing. So, part of our skills are just really noticing the person that's showing up now. So every day we're different human beings. Like we're talking about scaffolding with all these flaws, but gosh, the river never stops flowing. The river in any moment is always different to what it used to be. Right? So the person that you're working with is different showing up. Who are they now? We really be open to that. And we use the term in clinical world of baseline. So what's their baseline level of functioning, of presentation? And today, where are they in relation to their baseline? And so we're just tracking to what extent are they moving far beyond it. And so maybe we can move to part two of the question around when we bring in psychedelics and destabilization. But this idea of our baseline level of functioning and of being, some people get along just great, at low levels. So it is very relative. What does it mean to have a low level of baseline functioning? It might be we don't have huge social circles. We're not very wealthy. We might not be employed. We might not eat great food. We might not have great literacy around our emotional awareness and be able to express ourselves. We might not have any spiritual goals or aspirations or identity. So technically, people might think that's a low level of baseline functioning. But that person could be completely content. That's how their life is. So just something to be mindful of. And there's a teaching that I picked up a few years ago around people that use psychedelics. Psychedelics, are well known for being non-specific amplifiers, i.e. non-linear, unpredictable. We don't know what might happen during each journey, what might get accentuated and brought to the surface, what we might need to deal with. So when we're talking about competency, scope of practice, staying in your lane, being prepared, when you bring psychedelics into it, you really don't know. So you have to be prepared for the unprepared. And particularly there's a question around, what if a client's destabilized? What if they're not at their high level of baseline functioning? What if there's some trauma that's been activated? They are feeling unstable. They're feeling unsure about whether they can go back to work next week, whether they can continue, just functioning, answering emails, dealing with life in general, and having this existential uncertainty. Well, who am I? What is the meaning of my life? Maybe there's memories coming up from abuse as a kid. That what do I do with that? Or there's some shame around things that I've done in my life, my past. Maybe going into rehab or breaking the law, going to prison, whatever it might be. So a lot comes up for people. And I have been thinking a lot around Gosh, that could be the perfect opportunity for psychedelics to help somebody feel that, hold that, bring awareness to that, that exquisite noticing, exquisite sensitivity to whatever's coming up in that person from a place of love and acceptance and of wanting to give it space, to let it communicate, to let it move forwards, to flow into whatever comes next, to be held, supported, and then to take the time after that, days, weeks, months, to just stay with that person to help them figure out what comes next. Could be a really helpful ingredient. And psychedelics could be the absolute worst thing to bring into that moment right then. And I've seen it. I've heard many stories. There wasn't proper assessment and screening done. There wasn't proper, in a sense, professional responsibility to hold the patient back, the client back. Clients, they might not know what they need, or they might be so desperate for healing, or so, in a sense, nonchalant, overconfident, just to, oh, it's okay, yeah, it will help me. It's all for the good. Psychedelics help me, and my inner healing intelligence wants me to work through this. Okay, but do you have the support? What if you need to take a few days off work? What about your wife and kids? Uh, physically speaking, is your nervous system ready for potentially a huge amount of content and volume to be turned up? And what are you experiencing with psychologically and emotionally to turn it up the volume? Is it the right time? Are there other interventions that we could do it instead, just to help you get a bit more grounded and embodied, to get more support in your life? Maybe join a peer group, an integration circle, start speaking to people in your life so they know, yep, I'm dealing with suicidality. Some traumatic memories from my past have been coming up. I'm going to start working with someone around this using psychedelics. I just need a month of just working with it more somatically. So I'm going to start doing yoga. I'm going to start doing more meditation and journaling. Going to be part of this group. I'm going to start, taking walks in nature more, trying some breathing exercises, some breath work, just lightly titrating. So if we can do that, great. Let's do that and then talk about psychedelics. But if they're like, I got to do it now. This is coming up. I'm disassociated. I'm feeling flooded with memories. My nervous system is in overdrive. I cannot take it anymore. Well, I would honestly say, I don't know that psychedelics are the right choice here, or I don't know that I am the right person to work with you right now. If we had these hospitals or clinics or retreat centers that had doctors and nurses and therapists and yoga teachers and massage therapists, body workers, all in a wraparound service where we're thinking, okay, David needs a massage for a few days first. We'll do this breathwork intervention. Let's do some kind of past life regression or some IFS work with him. Let's do some nature therapy. Great. Okay, let's do that for the first week. And then we'll talk about some low-dose ketamine work, maybe just to do some psycholytic therapy with oral lozenges or maybe nasal spray of ketamine before we do the IV ketamine, before we do psilocybin. Let's not even think about ayahuasca or ibogaine for a year. Okay. So without that level
plan,
of
David, coming out again.
yeah, staged and staggered, but without that level of professional kind of, in a sense, acumen and excellence, but also accessibility with the client to be free to let's talk about this, then our people are at risk. And because psychedelics are illegal, criminalized in most places, or because these modalities, in a sense, exist in gray areas, it's really hard to know who to work with and how, what medicine to work with them, or what dose, when, individual work, group work, with a doctor present, with a nurse present. Do we need to take, their blood pressure, their heart rating? Do we need to check what meds that they're using? Probably the answer is yes to all of those. So if we're not, it's huge risk to us and to our client. So the destabilization, it could be an amazing time to work with someone. However, it could be the worst. And knowing the difference, if you're not in that role, don't pretend you are. You need to say that to your client, that you need to work with someone else that can do a proper diagnostic assessment, biopsychosocial assessment, including trauma and any medications that person's taking, and if there's any imminent risk of harm to self or other. suicidality, self-harm, eating disorders, homicidal ideation, kind of psychotic thoughts or dissociation, then yeah, that needs expert intervention immediately and a referral to that.
Yeah. So let's talk about screening, right? Because people like you have trained to spot some of these signs, right? And a lot of coaches out there will not have been trained to spot the signs. Some signs are obvious, some are more subtle, and a good coach will get curious about it, even if you can't name or label what this might point to, right? There is an intuitive sense of like, ooh, something's a bit off here. But if you were to talk to the coaches who don't bring that kind of sensitivity yet, that they're able to pick up on these things that might be an issue, even though they might not have been officially trained in that. Um, how do you screen? How would you tell coaches what's a good way of making sure that this client is coming from a resource place and that they're able to engage in psychedelics in a safe way?
Mm. Yeah, it's a good question. So I think, again, leaning into understanding a human being within the culture, within their society, family, relationally, looking at are they resourced enough? So they need to understand friends. Like, do we have friends? Nowadays, I was just doing some content around, can't remember roughly, but something like, I think 15% of men in particular don't identify having any friends right now. We spend an hour and a half a day indoors more than we used to compared to 20 years ago. 50% of people have 3 or less friends. So being resourced, in a sense, that for me is often the cause of our maladies, of our challenges, is not just being known, not feeling a sense of belonging, not having connection, not having time outside of work, whatever it might be, to be somebody else. So our identity gets often controlled by not having other people in it. So I'd say from a coaching perspective, I like to use genograms. That's a big social work thing. I don't know if anyone's ever used those.
Genogram.
Yeah, GENOGRAM. And it's a beautiful process to go through with a client. There's different ways. Some might just be drawing circles. It's a thing that they'll draw, or there's templates you can use online. That is a really nice way of identifying with a client early on who's in your life. And you can connect that to your identity as well. Draw lines between the people that you feel closest to or that have harmed you the most or that you've become less close to, and then use that to understand. So that's a really nice, simple tool.
Are you saying if somebody comes to you for preparing or integrating a psychedelic experience, there's it like it transpires they don't have any kind of social support network? Is that a reason to not work with them?
It could be, yeah. So the
How would you
genograms are
follow
not,
that up? Because
yeah,
that in itself, not necessarily, because it could really help them actually open something up, right? But I also see that it could point to lots of risks in terms of what support work there is or not. So,
yeah,
but how would you follow that up to figure out, is there risk?
yeah. So there's a few different ways to answer that. I had an experience with one client when I was the director of the outpatient addiction center in New Jersey, that was lying to her family about what she was really doing in life and her use of heroin. Um, and she was trying to get into my treatment center, basically just so dad would keep giving her money and she could keep, spending it and dealing heroin and other things were there. And she wanted to allow that to continue in the sense that dad would be paying for her treatment and giving her money, and in a sense I was part of this illusion that the family were part of, and I couldn't do that. So she had family support, but they didn't know what was really going on in her life, and she was in her 20s, late 20s, incredibly high risk, like dealing with gangs, prostitution rings, drug dealing. So it was really high risk. So I made that decision. Unless we can be real with the people that you have in your life, you're just going to continue living this illusion, and taking all these massive risks. So we didn't work with her, but I gave her the choice. So I guess that the lesson from that was one of the hardest decisions I made. But I spoke to my supervisor about it. He's like, yeah, that was the right thing to do. It gave her that choice. Ultimately, she chose. So the learning point here is dialogue and choice. So all of this is working with the client to dialogue who they are right now, what do they need right now, what have they got right now, setting some realistic expectations and timeframes. Okay, I'm willing to work with you. Sounds like we can do some good work together. If the work looks like this, at least for the next month, and let's just keep checking in and see how that goes for the next couple of months. Can we work together in this way? And it might be that psychedelics are not on the table for the first couple of months. And if that client can say, okay, I hear you. Yeah, there's some gaps in my life. There's some gaps in my knowledge of myself, or in you getting to know me, that we need to clear first. And then me jumping into the psychedelics piece can wait. And me wanting to rush into using psychedelics, I realize actually is coming from a different part of me, that in a maybe spiritual bypassing, or that just wants life to be easy, or that simply wants to get high, or to have this assumption of having something in my life that's there for me, that will be a quick fix. And I need to do some preparation. Like I need to prepare the ground beneath me, but prepare myself before going into that. So that's, I guess, just the first thing, is that dialogue and choice and decision making. And that's, one of the skills that we teach in our program is motivational interviewing, acceptance, commitment, therapy, are really important pieces around the dialogue and the agreement around how to work together, like just for now, in this first week, this first month. So that's the first thing I'd say, Yannick.
Mm-hmm. Yeah, it just points to how important it is to have a bit of time with someone. The more time we can get, the better. It reminds me of first time I approached a psychoanalyst. They said, "Oh yeah, let's start having conversations, and then we'll see if it can become, it will become an analysis." And in coaching, that would be unthinkable. Like people don't know what to do with that. But I think it's really helpful to, especially in a psychedelic context, if somebody comes, that's another question. Maybe I don't want to recommend psychedelics to people, even though sometimes I have a strong sense that I think that could really open something up for you. But I don't want to take that kind of responsibility. I think people need to make their own decisions. But even if they come with decisions already made, they want to have a psychedelic experience for whatever reason, to start talking and then see if they still need to have that experience, I think is super helpful. So what else do you do as in a way of screening? Or maybe not what else do you do necessarily, but what would you recommend to a coach who's coming to you without clinical background and saying, I want to figure out whether I can work with a person, or psychedelics will be safe for them, or at least safe enough so that I can do some coaching work with them?
Yeah. So screening and assessment, we are determining, is probably the most important thing to do. Without that, it means one, we have no idea if that person's ready. We don't even know if they're ready afterwards, to some extent. And then the other piece is, it's showing that practitioner is also not ready, or probably ethical professional. So if someone just says, oh yeah, sure, I'll work with you using psychedelics, without going through a certain bit of a protocol, without asking at least a bare minimum of questions, then they're not professional, they're not safe, they're not ethical, and they're actually engaging in a very risky behavior that could backfire on them greatly. So there
I gotta
are,
ask, what's the bare minimum of questions?
yeah, I'll share that now. Yeah,
We'll get there.
there is
Good.
some, there are, there's a great resource called Homecoming that actually has developed an eligibility test, in a sense of screening and assessment tool, developed by Brian Richards, who's worked a lot with sunstone therapies in America. And this tool is probably going to be implemented into national systems for determining eligibility in America for how to know who's the right patient for this, what kind of psychedelic, what kind of treatment, what kind of approach, and triaging it. So check out Homecoming for sure, because that's a natural evidence-based, very well developed, probably the best in the world right now. And at the same time, some bare minimum questions that you want to ask. So there's definite, I guess the first thing to say is we don't truly know what's a contraindication or not, which means a red flag, a eligibility criteria that would rule out someone using psychedelics. We have an idea about some of them. So if someone is in active mania, definitely we know that's not good. So are they in active mania now? How would you tell? So there's probably 5 or 6 symptoms you can look for: not sleeping, grandiose thinking, maybe overspending, for example. Just making big decisions, rapid changing of topics beyond normal, in a sense, selfhood. But it can
And
also
just to
be for
say,
someone.
coaches need to be really careful about that, because I've had coaches in supervision where somebody turned up who seemed to me quite manic, and for them it was just a really exciting client, because many coaches love grandiose ideas and they're really thinking beyond possibilities. Some coaches really try to get that out, like, if this coaching session today would go beyond your wildest imagination and you would create your dream life, what would that be? And so I think some coaches really want to open those kind of doors. And when there's then somebody
Yeah,
coming who thinks that, like, high speeds and they're really creative and they're really active and they're really motivated, I think it's important that as coaches we don't get to collude with those people, and that we take a step back, slow down, and ask ourselves, who might this person be? Because we cannot diagnose mania, but to get the signs, and then we need to figure out, is this a manic person pretending to be normal, or is this a normal, very motivated, very excited, passionate person? And it can be difficult to tell.
yeah, yeah. There, it can be. Some of it would be. It's great to have an emotional breakthrough that releases energy, belief, motivation, behavioral changes, lifestyle changes. However, those breakthroughs are kind of rapidly coming in multiple times. First this, then this. It looks like this. Oh, got this website. I've started this now. I've got this new business plan I've got here. I stayed up really late last night and I've emailed 20 people for this investment round. Okay, then that's probably a warning sign that something's happening. So there is a contraindication with a history of mania or a diagnosis of bipolar. For many people, that's a contraindication. Just that diagnosis, even if right now they're doing great. No, I haven't had a manic episode for 10 years. That's unknown. Some people will say, well, look, let's just take it slow and low dose. Maybe we'll start there, but it's a big risk. And there's no evidence to support that you're doing something safe or that the protocol that you're using is evidence-based and it's a standard of care, because it isn't. So a huge risk. Same with the psychotic disorder. Any experience of psychosis in your life, a psychotic condition like schizophrenia, schizoaffective disorder, that is a contraindication as well, whether they have psychosis now or not. And any family history, parents and siblings with bipolar or psychotic condition, that too. And then the other big contraindication is around addiction. Have you experienced any addictive relationships or dependencies, addictions in your life to substances, to gambling, to pornography? Talking about that, again, it may be there in recovery. Most psychedelics are not going to be addictive at all, because they often are quite terrible or challenging experiences and not something that you'd want to do too often. But for something like ketamine in particular, it can be. And ketamine addiction is a real problem, particularly in Britain right now.
Yes.
So those are just 3 basic things. I think other really important things to be talking about, you'd want to get on paper: any medical conditions you're being diagnosed with, particular cardiac issues, particularly using MDMA. Anyone's thinking about using ibogaine, that is 100% they need a medical assessment and cardiac monitoring during dosing. So that needs to happen in a medical facility. I'd also be looking, at their sleep cycle as well, how that's been, diet, and any other medications and supplements they're taking, particularly looking at antidepressants or benzos. If there's a yes to that, then I would want to work with a pharmacist or psychiatrist just to assess that before working with them. It's not for me to decide. So those are just some basics. And then, yeah, family support for me is a basic. So having family, friends, and some kind of enough physical sustenance. So routines of healthcare, of having health insurance, having a therapist, having a coach, having enough space in your life to potentially become destabilized. Do you have that ability to become destabilized before you come stable, before you have that breakthrough? Because you might break down for a while first. Are you prepared for that? Do you have your life in a place where you can allow yourself to surrender into a breakdown, to be destabilized for an unknown period of time, potentially, just in case that does happen?
Yeah. I take a slightly different direction, unless there's more around the screening that you think might be worth mentioning to coaches, though.
Expectations is huge. Yeah, huge. um, Working with psychedelics, because there's a lot of myths out there. There's a lot of hype out there. And,
How do you manage expectations without taking the part away that is helpful, right? Because like to have high expectations, it's kind of like a placebo. If you think it's going to help you, then it's going to help you. And but also I don't want you to have unrealistic expectations of what this outcome might be, but I also don't want to take too much of the hope and the expectations away, because I know it also works, right? So how do you balance managing expectations and still allow a potential placebo effect, or the power of expectations to do their job?
saying exactly what you just said there. That was it, Yannick. Acknowledging, acknowledging that, we both hope that this is a really helpful, powerful, meaningful, positive experience for you. Most of the time, it will be, and there's certain things that we can do to increase the probability of it being positive. And at the same time, I don't want to set expectations that influence your experience, that it needs to be like this or it shouldn't be like that. Because some research shows that excessively giving clients the warnings about psychedelics, of what the bad things that could happen, almost like you read on a label of a pharmaceutical product. When you hear those adverts in America, may cause kidney damage, may cause, erectile dysfunction, and all these warning signals that this could do this, it could do that. If you do that with people that use psychedelics, in a sense, you're giving this, I can't remember the term, but there's a signal that can go unconsciously into the actual experience. So you're influencing someone and changing their experience and expectation level. But at the same time, they need to be prepared that things might be hard, that it might not lead to positive outcomes, that it might be boring, it might be crap, it might be weird. So just normalizing all of those without going into too much definition, really normalizing that we don't know, there's some uncertainty, and it's best to hope for positive and to work together with that intention, really mindfully, doing good assessment, identifying what the boundaries are with touch, what my role is, what your expectations are of working with me, the timing of how we're going to do things, the music that we're going to play. So really defining as much of that set and setting as possible. So there's a bit more certainty there, more agreement there, creates safety. The client can feel more grounded in their nervous system. That in itself reduces the probability of having a challenging or an adverse psychedelic experience. So that's what the research shows, but it can happen to anyone. It really can. So just probably taking things slowly at the beginning. If someone's more psychedelically naive, lower dose, not combining and stacking psychedelics, that also research shows it reduces the chance of adverse experiences. Having enough time to integrate afterwards also is really important. Avoiding having drugs beforehand helps, or drugs afterwards helps. So taking a bit of a pause before and afterwards of other drugs and substances, just let your mind settle in as much as possible and just focus on that one thing, also reduces the probability. So those are just a few thoughts.
Yeah, I can't help but spot a bunch of the units that you have in your training, and also
Mm.
just having an eye on time. I think we could do another 3 hours easily, but I'm not going to let you go without telling us a little bit more about that program. And I think this is a really good opening because you've been ticking so many boxes. And I remember smiling when you sent me the draft curriculum, and I'm like, yeah, those are the kind of things that a coach really needs to know before they enter this, just to set a foundation of it. So I'd love you to talk a little bit about why this training exists, and what if there's a coach, particularly a coach who's interested, given that it's also for clinicians, but there's also a coaching track. um, Talk a little bit about what this is, why this exists, and why people should be interested in it.
Yeah, you got it, Yannick. So, having been a clinician, having worked in psychedelics for quite a while, and having had a coach in my own life, I've realized that it's so important for us to learn together. So, blended cohorts are so powerful to bring together students of different professional backgrounds. That really is one of the greatest kind of learning outcomes, to come into contact with people that are different, because so often psychiatrists go to their psychiatric conventions, coaches do their kind of coaching modules and training in their little bubbles. Working with psychedelics, a lot of the experience that we need to learn is shared, kind of in a sense trans competencies. um, and the course that we've developed identifies what are those core competencies that all practitioners can safely bring into their scope of practice, whether they're a coach, psychologist, psychiatrist, whatever they might be. That's something they can all learn and learn together. And so the course is going to have great teachers from around the world, mainly in Europe, coming in and presenting each week. So we've got 12 weeks of class, 10 weeks of experts coming in, one each week, talking about a different topic. The last 2 weeks is where students will share back their learning experience. And each week, the students will have a role play they go through in a triad. So there'll be 3 students in a group together, each of 10 weeks. They'll choose role play and work with it for 10 weeks. And each week, that life of their, in a sense, avatar role play will change. Something else will happen. There's something new they will need to respond to, using the themes, the topics, the skills that we're working on that week in class with our expert. We'll put it into practice in the triad. And those skills are more relational, more somatic, particularly. And there's an ethical aspect to self-awareness that we're really leaning into in the course. Knowing yourself, knowing your boundaries, your limits of scope of practice is an ethical, essential ability to have. We lean into this idea of multiple lineages and ways of knowing. So, i.e., from each other, but working with psychedelics, working with human consciousness, with healing, with trauma. It's not just a psychological or psychiatric thing. There's other ways of understanding it, from a transpersonal, from a Jungian, from an indigenous, from a harm reduction approach as well. And then I guess one of the other things that I'd like to say, we're planning to have a practicum in the springtime as well, probably in the Netherlands, where students and other practitioners in our community will come to do a in-person practicum where we are having an experience with psilocybin containing truffles and sitting for another student practitioner while they have psilocybin containing mushrooms, truffles in the Netherlands. So that's a part 2 of this. So we're learning, we're doing live classes, we're doing recorded, more the theory and slide decks that you can watch before class. And then we've got the triads that you engage with. And then we've also got skills labs, which are going to be recorded techniques, basic theory, and then activities to practice with friends, family, and with yourself around cognitive behavioral coaching, motivational interviewing, acceptance and commitment coaching, screening, brief intervention, referral to treatment, mindfulness-based stress reduction, positive psychology. So that's going to be infused throughout the course. And I guess maybe just to tell you a little bit about who the teachers are, if you might know, we've got Yannick is going to be there teaching around integration. So what to do post psychedelic experience, how to make it more meaningful in your life from a coaching framework. Working with Dr. Erica Zelfand around the how to hold space for people during a psychedelic session. With Sergio Perez Rosal, a wonderful doctor, also in Berlin. He's working around how to know your scope of practice and build your professional kind of roadmap ahead. Dr. Ryan Zafar from Imperial College London, he'll be sharing his experiences of working on depression and addiction trials in Imperial College, just understanding the mechanisms of how do psychedelics work. Matthew Skinter's great. He'll be talking about embodiment and functional analytical psychotherapy and mindfulness. He'll bring in some Buddhist teachings as well. Dr. Helena Aisha talking about set and setting. She's based in Switzerland. And yeah, Brian Richards is going to be talking about the screening and assessment. He works with Homecoming as well. Eligibility, how to know if someone is ready to use psychedelics. And the course starts September 30th. And
this is 2026.
2026. Now, goes for 12 weeks. Go to Mirari, which is mirari.academy. And if you would like 10% off, then you can use the code Yannick10 at checkout to get a 10% discount. And we've got payment plans as well, because, yeah, it's not always easy to just stump up the whole tuition fee. So, yeah, there's payment plans available as well. So you can stagger monthly installments.
Yeah, cool. I had that question sitting on my mind earlier, and since you mentioned there will also be, or could also be, you're planning an experience where you also sit for each other. Some coaches decide to sit with their clients during the experience. Other coaches draw a line there. I'd love you to talk a little bit about the benefits and pitfalls of sitting with somebody that you help prepare and integrate, right? Rather than leaving the experience to them and then coming back into the experience as the substance has left, right? Because there's a lot of neuroplasticity going on. They're entering technically a vulnerable state, right, where they're very suggestible. So it's like it's very technical territory, embedded with risks and also lots of potential for the practitioner to be there. So I'm curious about the decision to integrate it into the training, to also teach the elements of sitting with somebody. I'm not talking about guiding. I think there's some different things, but I'd love you to talk a little bit into that space. And I also appreciate we have 15 minutes left.
It's a big question.
We do a few. We do less short fire questions, and I think this is an important one. And I'd love your perspective on it.
It's a big one, Yannick. It's really important to go into the detail here, because we will probably be asked by clients, will you sit for me? Or can you be with me while I use psychedelics? And we need to know how to answer that. It comes up all the time. We'll also get asked, can you get me psychedelics, psilocybin or MDMA? So we need to know how to answer that. It's our own decision, keeping in mind the criminality of psychedelics right now and the risks that causes, both to people using them because they're not tested, they're not verified, you don't know the exact dose, and it means we are working in a gray area. So you need to decide yourself what your risk preference and profile is, how much risk you're willing to take. I've worked with some people who are in their 60s and 70s and they're like, you know what, I just want to help people, so I'm willing to risk my own license, my own profession. Or they even just say, I'm just going to give up my clinical license, my psychologist license, my doctor's license, and just work with somebody as a coach, as a guide. So I have a bit more freedom. The biggest thing I would say is just knowing what is your scope of practice. Like, what are you able to work with confidently and competently? What are you trained for? How well are you prepared to deal with the unexpected? Because if you're going to sit with someone during a dosing session when they use psychedelics, you need to feel confident and competent to deal with the unexpected. Otherwise, you're not ready, and you'll be sending a signal to your client that they're not safe. They're not really being held. So we say space holding, but you're holding that client's nervous system, maybe their consciousness, maybe their life. So you need to know that you're ready for that and for the unexpected, and have plans of what to do if something bad happens. Contingency B, contingency plan C. You need those in your back pocket. Who'd you call? Where'd you go? What have you agreed with the client before they take the medicine? Most of the time, I would say to people, probably don't, unless you're really, really sure. And if you've done the training and you know it, probably don't sit with them during that session, unless you can justify it from a harm reduction perspective, which is saying, look, this person's going to do it anyway. They've told me. I am not telling them to do it. I'm not giving them the medicine. I am simply being there to ensure that I can reduce the chances of something bad happening. Either I reduce the chance of them tripping over, going to the toilet, or having maybe a heart attack, or experiencing a respiratory issue, or if they have a little bit of a panic attack or a freak out, or want to know, am I still here? Am I dead? Am I alive? Is my body still here? Who am I? Where are you? So that I can give them some of that reassurance. That's harm reduction. So there is, in a sense, a legal justification for that. Would that stand up in court? Probably not, depending on how well you explored this with your client, and how much training you have, how aware you are of research, of competency frameworks, of evidence-based practice guidelines around how to work with people during these experiences. It still wouldn't be valid in a court of law, or to your board, licensing board, or your insurance company. So it's still a risk. I think there's a difference between sitting, guiding, facilitation, coaching, and therapy. Five different things. Knowing which one of those you are and are not is essential. And it may well be that you want to work in a team. So it's better to have two of you in a room with it rather than one, with different credentials and scopes of practice. That helps to mitigate some of the risk factors, because you could well get accused of some sexual misconduct, or some kind of professional malpractice or incompetence. Having another person can help with that. Recording the session as well can help with that. But also that recording can be then used as evidence that, oh, I am breaking the law, not knowingly. Again, your decision, your risk profile. I like what you said as well, Yannick, around I'll work with you before, I'll work with you afterwards. I can't be with you during the session because of these legal liability reasons and my own scope of practice and confidence. So what you need to do is have a plan of what to do if you're having a difficult time. Have a family member present or a friend present. They're not doing that professionally. They're not being paid. They're just being a friend in the room, or in the house, in the room next door. Or the very worst case scenario, do you have a helpline you can call? In America, there's Fireside. So you can call Fireside. It's not 24/7, but a lot of the time they'll help. If you have a history of panic attacks, if you're taking medications, then you need to have someone clinically licensed that can assess it before you do this. I won't work with you coming into the room afterwards, or for you to expect me to come in if you haven't had a proper kind of medical clinical assessment. If you're taking meds, if you've got these diagnoses, if you're this destabilized, I can't do that. But if you do, and it's got the all clear, and we've had the sessions beforehand, then I can meet you at the end. I'll come in, we'll drink some tea together. We'll have some music in the background. You can lie down, you can sit up, maybe you can walk into the garden, sit on a bench, do some yoga, do some journaling, whatever that might be, that I can do. But when you're still in an active, acute stage of, in a sense, you could call it intoxication. You could also call it being in an extraordinary or non-ordinary state of consciousness. That's where I can't be with you, because it's beyond my license or scope of practice. So for our own both mutual best interests, I need to wait until that's passed. Some people do that, but it's a really tricky one. And that's why if we had proper facilities with, in a sense, what's called rotating coverage, then we can have a scaled system of working with people. So the psychiatrist is there for the prescribing, the monitoring, the nurse will do the heart rate, the pulse. You'll have to do the administration with a nurse. Then you'll have a coach trained and competent for the actual medicine session. And then maybe a therapist will come in if they're having a challenging experience. And then it's really nice as a therapist to be able to work with them as they're coming down the tail, doing the integration work at the very beginning. So what came up, David? Tell me about it. let's see, I just spoke to the coach that was with you during it, and this sounds like these were the main themes. What was that like when you spoke to your deceased grandfather about your mental health journey or your trauma as a kid? Well, is that something you want to, is that where you want to go? Or do you want to talk about just maybe nothing? Do you want to just sit and just still be in that blissful space right now? And I'm here with you for whatever you need. It's really that's the most, in a sense, the best bit. The dosing bit can be a bit crazy, a bit wild, intense, but it's when they're just coming down that tail, when they're still in it, but also not in it. That's where, in a sense, their consciousness, their ego is really loose. Emotionally, they're more lubricated. They're more kind of flexible neurologically as well. So it's a really powerful place to be working with people around like what's at the surface, what's present now, this, and this. Okay, so they're all welcome there. Let's bring all those to the surface. Hold space for those. I'm with you. Let's go.
Yeah, it's so that's the part, the time that I always thought about when I thought, ooh, if that wouldn't have been my friend that I was chatting with, but a trained coach who also is very aware of who I am and my intentions, that could have been so fruitful. And also, I'm still in something here. I'm still quite vulnerable, right? I'm still quite suggestible. So there's a lot of responsibility that comes up when you start working with people as they're coming out, but still in it.
Yeah. And
Whole
just to
topic
say,
on its own.
yeah, we spoke about resourcing and having people in your life. So that's again is essential, especially if you want a family member or friend to be with that person in the room, or at least maybe they can be in the room next door during the medicine session, during the dosing. And that having them available there to do that role, in a sense, reinforces that they're in that person's life, that they know what's going on. They are okay with that person using psychedelics. So that again feels safe to that person. They've got support available if they need it. And again, the research shows that the ability to surrender to the experience, to meet it, accept what comes up is really helpful. And so knowing that there's a family member in the room or just in your life that's up to speed, supportive, that helps the person to surrender into it. Because often when they don't have that, they fight against the experience. They freak out against it. What does this mean? I don't know what's going to happen next. I don't know that I can hold this. I might be going mad. So without
Yeah.
someone there that can reassure them, that knowing that they've got someone they can actually process it with, it makes it worse. It, in a sense, feeds, it amplifies that insecurity, that doubt, that existential kind of shock.
Yeah. Yeah. Also, I like to get in touch, if appropriate, with the person who is going to be sitting with my client, because I choose to not be there. I can be like around in the vicinity if somebody wants that kind of support, but I wouldn't be there sitting with. But I love to talk to the people who will be sitting with and just see if it's appropriate that, if somebody adopts a certain body position, or they say one word over and over again in these 10 minutes or something like that, then if it would be okay with my client for some of that to be passed on to me, or to
Mm-hmm.
my client to then pass on to me, just so we can get curious about some of the things that happen that the client might have immediately forgotten about.
Yeah, that's a really good way of doing it, definitely. Sometimes the coach can, or the person sitting with them can take some notes about what was the main things that came up. And it might be one word or one image or one body position. Yeah. When you did that, what was going on then?
Or a song
Yeah.
they reacted strongly to, whatever it might be.
Yeah.
David, we have 5 minutes on the clock. I told you our quick fire questions are very complex questions, and the difference really is I say thank you. In 5 minutes, what can we do? I'll pick a few and see how short you can keep it. I
Deal.
think an easier one would be what are some of the books or people that have like had a significant impact on your work?
Yeah. Uh, have to start off with people like Rick Doblin at MAPS. He's an amazing man. He's been advocating and fighting for legal access to psychedelics and decriminalization of drugs since the 80s. So check out him. There's also Stan Groff, who obviously people probably know about. These are the kind of two really huge people. Understanding transpersonal states and psychology is really important. So Stan Groff is one of the kind of main folks that spoke about that, from the 60s onwards, and holotropic breath work in particular, is also really fascinating. So he did that book, The Way of the Psychonaut, 2 volumes, big ones. James Fadiman as well has written some great books about microdosing more recently, but there was a book in maybe 10, 15 years ago he wrote. I can't remember the name of it.
Psychedelic Explorer's Guide.
That's the one. Yeah, that's exceptional.
It's excellent, yeah.
And let's just think who's here now, more modern day. There's a really good book called Fellowship of the River by Joe Tafur. And I love that because it's his personal experience of being a doctor, having trauma, doing his own healing with psychedelics, and then realizing he needs to change his career into psychedelic medicine and opening a retreat center in the Amazon. And he's talking about the way psychedelics work on different levels of the body, the energy system, the immune kind of endocrine system as well. So just understanding from a biological, medical, he explains that really well. I respect Paul Austin a lot in his third wave. He's particularly around coaching, microdosing. That's some really good content that he produces. So there's just some starting points, quick fire.
Yeah, good. For a coach who's stepping into this world and getting quite curious about it, maybe they had a psychedelic experience and they feel really called to do this work, what would you tell them? / what would you wish you had known when you got into this?
Yeah, happy to answer that. I'll answer it with another addition to the previous question. Rosalind Watts, Ros Watts, is wonderful. She's got a new podcast, Stepping into the Circle, I think it's called, and a community called ACER, which you can join as a coach. And it will give you a 12-month experience of being part of an integration community. So that could be great. If you've had your own experiences with psychedelics, you want to learn how to belong and exist in a group and support other people using psychedelics. I think next steps for coaches, honestly, I think embodiment is the best thing. So developing your own practices, your routines that help you become more embodied, more integrating of your kind of shadow material, more accountable, more self-aware. That's the most important piece, I'd say, around training, but more so just around lifestyle, identity, and experiencing into your daily routines. Nothing can beat that. So if you're not very embodied, asking yourself right now, am I embodied now or generally? If the answer is no, then there's nothing better that you can do in your life than finding ways to become more embodied. And that could be through microdosing yourself, could be through yoga, meditation, could be other ways, chanting, dancing. Anything that can get you more embodied. I'd say that is the number one thing that will help you do your own inner work, and to be more tuned into your own intuition and to know what your competencies are and to be able to connect with your clients more authentically.
Yeah, good. Last question. If you could send a message to any person or group of people, including the whole world, right? You're like taking over somebody's phone or screen that they're currently looking into, and you've got a minute to say something. What would you say and who to?
Oh, definitely want to take a breath into this. I would say a new word, love. Love is just so important. So finding love for yourself is the hardest thing sometimes and the greatest challenge and the most powerful experience of life. To love yourself and to help other people to love themselves and to each other. So in a sense, the word love, letting that sink into your body right now, love, normalizing it. It's not a dirty word. It's not a kid's word. It's a beautiful, profound word, and it's an experience of existing, of being, of living. And by infusing yourself with just that word of love and opening up and surrendering into wanting that experience to be with you It identifies where the blocks are, where the resistance is, where the pain is, but also where the greatest need is for more love. And because you love yourself, you want to give it to yourself exactly where it needs to be.
I love it. David, thank you. Where can people go to learn more from you, be more with you, step into your sphere in some meaningful way?
You got it. So come to psychedelic conferences. They're great. I'll be there. There's one coming up in Prague, October the 13th. So that'll be a new place for me. I don't have a website. I tend to hang out a lot on LinkedIn. So go find me, David Drapkin, LinkedIn. Or you can go to mirari.academy and find me there. Yeah, happy to chat about all of these things. Just send me a message on LinkedIn.
David, thank you so much for your time. Thank you for your work. Thank you for what you're bringing to the intersection, to coaching, to coaches by extension. I really, really underline the connect beyond your bubbles and boundaries. And so bringing the community of people who work with and around these substances together to connect, to learn, it just means a lot. So I appreciate that.
Beautiful. My pleasure. I've been looking forward to it, and I'm so happy we had such a long time to chat on this episode. Thank you, brother.
See you soon.
Cheers.